Hello students, my name is G. Nikita, M Pharmacy Assistant Professor in Department of Pharmaceutical Chemistry. I will deal the Medicinal Chemistry 2 subject for B Pharmacy 3rd years first semester. So today we are going to discuss about oral contraceptives, that is the 4th unit. In this, we will discuss introduction means what are the oral contraceptives and what are the types of the oral contraceptives and its mechanism of action, adverse drug reactions and uses. So let's see what is the oral contraceptives. So the advantage of the oral contraceptive pills have revolutionized method of contraception. So this oral contraceptive pills are also known as birth control pills, means it is used to control the birth rate. So it is composed of the estrogen and progesterone or both. Means it may contain either estrogen or progesterone. In some cases it may contain both. And apart from being available over the counter of means there are many advantages like rapid reversible of fertility and reduce the changes of development, premenstrual tension and arthritis, anemia, and also the reduce the risk of the pelvic inflammation disease with which is high with IU series. The full form of the IU series is intrauterine device, means it is the device used to control the birth rate, means it will prevent the formation of the pregnancy. Here the oral contraceptives is nothing but it is used to avoid the birth control by avoiding the pregnancy in the female. So what are the types of the oral contraceptives? First one is combination pill. So it is given in the form of the combination with estrogen and progesterone, means it contains the both. Combination means combining. So it contains the progesterone and the estrogen. So these are the most and safest method for the contraception, means for the birth control. Means it is the 99% more effective when we compare with the other methods. So it contains the balanced formulation of the estrogen and the progesterone. So how we should take this drug means the first pill should be taken on the 5th day of the menstrual cycle. Means basically if you observe for the ladies, the menstrual cycle may be continued for the 5 days. So on the 5th day, this drug should be taken and it should be continued for the 21 days. So after 21 days, this drug should be stopped for 7 days. Means when we stop this drug taking, means at that time what will happen, the menses will be start for the ladies. So this drug should be taken on the 5th day of the menstrual cycle and should be continued for the 21 days. And after the 21 days, this drug should be stopped for 7 days. Means this drug should not be taken. Means this drug should be completely avoided for the 7 days because of the menses. So the menses will be completed for the 5 days. No, after on the 5th day, again this drug can be continued. So it can the combination pills. What it will do, it will suppress some of the hormones that is responsible for the causing of the pregnancy. What are they? What they will suppress? It will suppress the LH, means luteinizing hormone and follicle stimulating hormone. So follicle stimulating hormone in shortcut we can call as FSH. So it will suppress these two hormones, that is LH and FSH. So it will completely inhibit its mechanism, this combination pill. So in the absence of these two hormones, what will happen? Ovulation is inhibited, so which is similar to the natural process occurring during pregnancy. So if these two hormones are inhibited, what will happen? The ovulation process will not occur. So if the ovulation process is not there, means the pregnancy formation is also not occur. So by relatively of estrogen and the progesterone from ovaries and the placenta. So if we use this drug, it will suppress the activity of the two enzymes, that is LH and FSH. So if it is depress this activity, what will happen? Ovulation does not form in the body. So if the ovulation does not form, means there will be no chances of formation of the pregnancy. And the progesterone, it will ensure the withdrawal of the bleeding after stopping of the medication. So while using this medication, what it will do means there is no menstrual, we can't able to find the menstrual cycle, means bleeding in the woman. So when we stop this medication, what will happen means the bleeding, the menstrual cycle will be start immediately. So it also takes the cervical mucus thick by increasing the viscosity and hence make the sperm penetration difficulty through the cervix. So the combination pills are three types, that is monophasic, biphasic and triphasic. So how many? Three. That is monophasic combination pill, biphasic combination pill and triphasic combination pill. Means here the what will happen here, we will use both progesterone and estrogen, but the combination of the concentration of the progesterone and the estrogen has been different in these three types of the pills. So let's discuss what is the monophasic combination pill. So here what will happen? Here both progesterone and the estrogen both are present, but here these both are taken in the same quantity. It may be in the increased form or the decreased form. So if it is decreased means both the quantity are increased. If it is decreased means both the quantities are decreased. So here both are taken in the same quantity for 21 days. See here, the monophasic is given to the combination pill as there is no phasic increases or decreases. This means it may increase or the decrease in estrogen and progesterone combination. During the time dosage is 21 days. Means this drug should be taken for the 21 days. In the biphasic combination pills, what will happen? Here, the estrogen is taken in the fixed quantity, but the progesterone is increases for the two successive periods. Means the estrogen has been taken same quantity for the two periods, but the progesterone is increasing its quantity. So here we are seeing the two periods. So the first period from day 1 to 10 days, means from first period it started from the 1 to 10 days and the second period is started from the 11 to 21 days. I said no that this drug should be taken for the 21 days. So here up to 21 days. And after the completion of the second period, we have to stop the medicines of for 7 days for the menstrual cycle. See here, this pills on administration, the hormonal changes occurs during the menstrual cycle. So they contain fixed amount of the estrogen for 21 days and also the dose of the progesterone is increased for the two successive periods. So here the first period from day 1 to day 10. So here ethinyl estradiol is the, how much we have to take in 35 mg. So it is the estrogen drug and the norethindrone should be taken 0.5 mg. It comes under the progesterone. So in the first period, we have to take this much amount. If you see the second period, it starts from 11 to 21 days. So here what will happen? The estrogen is taking as 35 mg. As usual, it is not increasing here. But if you see here, the progesterone, it is increasing. It became double. See here, in first period, we are taking 0.5 mg. Here we are taking 1 mg, means it has been doubled. So in biphasic phase, we are using both estrogen and the progesterone. But the estrogen is level does not increases for both the periods, but the progesterone dose is increasing in the second period. Next, triphasic phase. So here 3 periods will be there. Period 1, 2 and 3. So here in this triphasic combination pills, what will happen is the progesterone dosage form will be increases. But in the estrogen, what will happen in the period 1 and the 2, it will be remain same. But in the period 2, the dose will be increases. So in the progesterone increases its level continuously, period 1, 2, 3. But the estrogen level, it remains same in first period and third period. But in the second period, it will increases its dose form. And the same as usual, we have to take this drug up to 21 days. And after 21 days, we should stop taking of this drug for 7 days for the menstrual cycle. See here, the pills on administration, the hormonal changes occurring during the menstrual cycle. They have high dose estrogen at mid-cycle. So mid-cycle is nothing but period 2. And the progesterone doses are increases in all the phases. See here, the phase in period 1 from 1 to 6 days. And period 2 from 7 to 11 days. And period 3 is 12 to 21 days. If we see in period 1, here the ethanoyl ostriol is the estrogen level. So here we are taking 30 micrograms. And here norgitril, we are taking 0.05 mg. So it is the estrogen and it is the progesterone. So in the day 2 from 7 to 11 days. So the estrogen in the second phase, I said no, it will increase. See estrogen at the mid-cycle, it will increases. Mid-cycle here is what? Here is the second period. So in the second period, it is increases from 30 to 40 micrograms. And the progesterone level is also increases, that 0.075 mg. And in period 3, again the estrogen level has been same as when we seen in the first period, that is 30 micrograms. And here the progesterone level has been increases to 0.125 mg. See here, it has becoming double. In first, second and third period, it has becoming double its dosage form of the progesterone. So here nothing but the monophasic combination pill, we are taking both estrogen and the progesterone in same quantity. It may be increases or decreases, the both level may be increases or the decreases in the same quantity we are taking for 21 days. But in the biphasic combination, what will happen is the estrogen level maintenance is same for the two periods, period 1 and the 2. But the progesterone level has becoming double when we compare from the period 1 and the 2. So in this drug also should be taken for the 21 days. After the 21 days, this drug should be stopped for 7 days for the purpose of the menstrual cycle in the ladies. In the triphasic phase, it has a 3 periods, period 1, 2 and the 3. This drug also taken for the 21 days. Here what will happen? The estrogen level has been same in the period 1 and the 3. But in the period 2, it will increases. But the progesterone level going on increases if for the periods, means that in the period 2, the progesterone dose is more than period 1. In the period 3, it is more than period 2. So the dosage level has been increases for the progesterone. And also this drug should be stopped after the 21 days. And this drug should not be taken for the 7 days for the menstrual cycle. So second one is progesterone pills or mini pills. So next one is mini pills or progesterone pills. Here what will happen? These pills are given to the person where the estrogen is contraindicated. Means contraindicated means here it may have that some persons may have the side effects of the estrogen. So they contain small dose of the progesterone should be administered throughout the menstrual cycle. So in this what will happen in the mini pill means here only small dose of the progesterone is present, but not the estrogen is not present here. only the progesterone is present, that is in the small dose. So this drug should be administered throughout the menstrual cycle. Means how many days the menstrual cycle will be there, no? That many days we have to take this drug. But when we compare the combination pill and the mini pill, the combination pill have the more useful when we compare with the mini pill. So here the success rate of the mini pill is very less when we compare with the combination therapy. And also it has the side effects like headache and breast tenderness, bleeding disorders in the women, and water retention we can able to see here. And also what it will do, it will increases the viscosity of the cervical mucus and make the sperm fermentation difficulty. So it does not allow the sperm to fermentation in the body. And also it will prepare the endometrium prematurely for secretory phase. So here what will happen in the mini pill, it has only progesterone, not estrogen. So only progesterone in the small dose it is present, and it should be taken throughout the menstrual cycle. But when we compare with the combination therapy, it has the less therapeutic uses when we compare with the combination therapy. And also the success rate is very less. And also it has the side effects like headache, breast tenderness, bleeding disorders, and water retention. So how it will work is, it will stop the sperm fermentation in the body. But this drug should be taken throughout the menstrual cycle without stopping. So this is about the mini pill or progesterone pills. So the mode of action is primarily on the cervical mucus, and which is made inhospitable to sperm. So means the main role is to stop the penetration of the sperm in the body. The mode of action is nothing but it is to avoid the pregnancy in the females by stopping the penetration of the sperms in the body. So the mode of action is primarily on the cervical mucus, which is made inhospitable to sperm. The progesterone probably also hinders the implantation through its effect on endometrium and the most modifying and secretion of the fallopian tube. So here some of the drugs trade names are there. So means which is available in the market, and in this drug, in this medicines, the progesterone and estrogens are there. So how much amount of the progesterone levels are there, how much amount of the estrogens are there, we see. So the Mala D, if you see the progesterone level here, 0.3 mg is there, and estrogen level, that is 30 micrograms is there. And if you see the second one, overall G, here the progesterone level is 0.5 mg and estrogen level is 50 micrograms. So here, based upon the different drugs, the dosage form of the progesterone and estrogen levels are different. See here in the Bandhan, the progesterone level is 0.5 mg and estrogen level is 30 micrograms. So here for different drugs, the estrogen and the progesterone dosage forms are different. And next one is Novelone. Here the progesterone level is 0.15 mg and estrogen level is 30 micrograms. And next last one is Femleon. Here the progesterone level is 0.15 mg and the estrogen level is 20 micrograms. So these are the different dosage forms that is used for the oral contraceptives. So what are the side effects? That is nausea, vomiting, breast fullness, headache, feeling of the dizziness, and sometimes the person can also able to go into the depression, pelvic pain, sudden weight gain, irritation, skin changes, and owing to the fluid retention. So these are the side effects in the oral contraceptives drugs. So third one is morning after pills or post coital. So this drugs when we have to take in means of these drugs are generally taken after unprotected sexual intercourse. So means after this process only we have to take this drug which contains the high dose of the estrogen and the progesterone. So in morning pills containing heavy dose of the estrogen and the progesterone. So what are the adverse effects in case of the estrogen effects and in case of the progesterone effects? So there are mild effects, moderate effects, and serious effects. Let's see mild effects in estrogen effects. So in mild effects, what are there? Nausea, migraine, breast tenderness, mild edema, withdrawal bleeding fails to occur. So in case of progesterone, increasing of the appetite means increasing of the hungry. Hunger levels will be increases, weight gain, and body temperature will be increases. These are the effects we can see in the progesterone effects. Next, moderate, that is vertigo, precipitation of diabetes, leg and uterine cramps. Here, breakthrough bleeding, and absence of the menses means menses won't come in the side effect of the progesterone, and uteral dilation. If you see the serious effects here, what will happen? Thromboembolism, jaundice, hepatic edema, and in case of the progesteronic effect, that myocardial infarction and cerebrothrombosis. So these are the side effects when we use the oral contraceptives. So these are the references books we have to follow for this topic, that is oral contraceptives. See here, oral contraceptives meaning itself is this drug should be taken through the oral route. So this is the references books. Thank you.